Mrs. Koenig is going to teach us how to maintain high-speed hand pieces. And this you would do if one of the supervising dentists had used the handpiece on one of your patients during clinic. Again, Mrs. Koenig is very excited about this, so pay close attention. Oh, I think I hear her coming.
This is the high-speed handpiece that a dentist would use on a patient to change the occlusion, mainly.
Mrs.
That's
Koenig,
why we do it here.
Mrs. Koenig, I'm just going to tell you one thing. This class, they're not going to do high sealants. And so they probably, I mean, they need to know how to do this anyway, but they probably won't need it. But please go ahead and share with us.
The supplies for lubricating the high speed is right here in cabinet number 23. And what you would do is you would clean this handpiece with just plain water, and you would wipe it down. These handpieces don't have fiber optic, so you don't have to worry about that, but some do, and you would have to just try to clean it right there. Make sure the fiber optic is clean, but all you're doing here is cleaning it with water. Once it's cleaned, you want to lubricate it, and the lubricant is a spray bottle, and it already has the right nozzle for it. And what you want to do is you want to cover your handpiece with a paper towel. You want to cover the head of the handpiece, because as you spray it, it will come out through the other end. So what you want to do is spray the short tubing, and this one is again gold, and sometimes the gold disappears, but in this one you can see it's gold. So all you want to do is one short burst of air for about a second. That's it. Then you want to take it back to your chair and run it without a burr, and run it for 30 seconds. You bring it back, you wipe it really good, and then you want to bag it, close it, label it with department, your name, and the date, and you put it to autoclave.
Okay, Mrs. Koenig, may I ask you just a couple questions? You said that before you bag it, you wipe it thoroughly. Is that to get the oil on the outside?
That's right.
And if I don't get the oil off, what happens to it when it's sterilized?
The oil gets, as you can see, because I didn't wipe it really good, the oil gets on the paper side of the bag.
Okay, and does it bake on the outside of the handpiece and leave marks on the handpiece, or no?
It leaves, and it helps, sometimes it will burn the paper.
Okay.
And it will leave marks on the handpiece, so you want to wipe it really, really good.
Okay.
And since you guys didn't see me run the handpiece, normally when you run the handpiece, after putting the oil in,
okay, so I take
the oil through. Okay.
Okay, so this is when I take it back out to clinic.
Yes.
Okay.
So you wouldn't have this much oil.
Okay.
Okay. But you will have a little bit, so you still want to wipe it really good.
And when I'm running it in clinic, do I want to keep the paper towel over the head of it so that the oil doesn't go onto the floor or anything? Okay. Can I ask one more question, if I may, please? Can you tell me what the name is on the aerosol can that you use to lubricate that?
It's called W&H Service Oil.
Okay. Great. Mrs. Koenig, thank you very much. We really appreciate your help.